it's CJ. Welcome to week 25 of your pregnancy. Today we're going to talk about what's happening with your tiny human, some of the more common symptoms that you might be having, what you can do to help alleviate those symptoms. And if you stick around, I will give you some information regarding symphysis pubis dysfunction, SPD, also known as pelvic girdle pain. At 25 weeks, your baby is now about the same length as a zucchini, measuring right around 13¼ inches or 33.7 centimeters from the top of their head to the bottom of their feet, and weighs about 1.5 to 2 pounds or 673 to 894 grams. This week, your baby's eyelids are no longer fused and he or she is able to blink. Fat cells are starting to accumulate. The lungs are continuing to mature in preparation for life outside of your uterus, and 4 of the 5 senses, sight, hearing, touch, and taste, are continuing to develop. If you were to deliver this week and you have access to excellent neonatal care, your baby actually has an 80% chance of surviving. So here are some of the more common symptoms that you might be having now that you're 25 weeks pregnant. Number 1, your fundus, or the top of your uterus, is now measuring between 23 and 27 centimeters from the top of your pubic bone. Number 2, your hair is thicker and healthier than ever. Number 3, itching, especially on your breasts, your tummy, and your hips. That's usually because of dry skin, and applying a lot of moisturizer can help with that. That being said, if you are having itching on the palms of your hands, the soles of your feet without skin changes, or you're having itching that is much worse at night, please talk to your provider about that. Number 4, insomnia. It is really hard to get comfortable, and once you do get comfortable, you usually have to get up and go to the bathroom, so sleep is almost impossible. I recommend emptying your bladder before you go to bed, not drinking any fluids for 2 hours before you go to bed, and get yourself a pregnancy pillow if at all possible. Number 5, feeling dizzy or lightheaded. That's because you have extra blood volume and your heart is having to work harder than it has before. I recommend making sure you're staying well hydrated, eat a little something every couple of hours during the day, and try to avoid getting up quickly from a seated or laying down position. Number 6, gas or bloating. It's because of those pregnancy hormones. I recommend eating a diet that's high in fiber, avoiding foods that can cause gas, and if at all possible, try to stay active during the day. And number 7, symphysis pubis dysfunction, also known as SPD or pelvic girdle pain. So, what exactly is symphysis pubis dysfunction? SPD, also known as pelvic girdle pain, affects about 25% of pregnant women. Typically happens in the 2nd or 3rd trimester. So in your pelvis, you actually have a piece of cartilage in the front that men don't have. That cartilage stays bone hard the vast majority of your life. In the 3rd trimester of pregnancy, however, your placenta creates a hormone called relaxin. The job of the relaxin is to soften up this piece of cartilage so your pelvis can expand and a baby can come through when it's time to give birth. So what can you do to help with those symptoms? Number 1, wear flat-soled, comfortable shoes. Number 2, maintain good posture. Number 3, try to avoid sitting for prolonged periods of time. Number 4, sleeping with pillows in between your knees at night. Number 5, a pregnancy support belt. Number 6, when you're getting out of your car, try to keep your knees together. Number 7, you can put cold compresses or ice packs on your pubic bone. Number 8, take over-the-counter pain medications as recommended by your provider. Number 9, if you're doing weight-bearing exercise, such as walking, try switching to something that's not weight-bearing, like swimming. Number 10, if all else fails, try to see a chiropractor or, my favorite, a pelvic floor physical therapist. I do hope that this information has been helpful, and that if you have any questions, you'll leave those for me in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button, or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.